You're a local gal. Please tell me a little bit about where you grew up.
Yes, so I am born and raised in a little farm town called Alhambra. I went to Highland, Illinois for high school, and then I went to Mizzou for undergrad, stayed in the Midwest, went to Kansas City for med school, and then came back to the St. Louis area for residency. Right now I live in Edwardsville, which is where my husband's family is from.
When you were a little girl, when did you realize you wanted to go into healthcare?
So for the longest time, I wanted to be a vet. So I liked that idea of helping, but then I, at some point, switched over to wanting to help the human side instead of animals. So it was really in high school when I knew that I wanted to do the healthcare route. Initially, I thought maybe nursing, and so I had worked with one of our teachers there that did like a medical intro to medical occupations class, something like that. And we talked about nursing, and then I decided, you know what? I think I want to be in charge. So then I decided to go full force to medical school.
And good for you. And I love that you say you're from a small farming community. It makes sense that initially with that, you had the passion for animals. But then you're like, no, I like people too. I want to be in charge. You went to Mizzou. What did you study there?
I did biology and psychology. So I did double major in those two. Most people who go to med school, they'll do a major in one of the sciences because there's so many science classes that you have to take. So I did biology, but then I also like the psychology aspect too.
You get into school in Kansas City. What was that experience like?
It was grueling. Med school is definitely, it's not for the faint of heart. But you know, I really liked my time in Kansas City. I liked living in Kansas City a lot. I say that if my family were all there, I maybe would have stayed in Kansas City, but ended up coming back to St. Louis. So the first 2 years are all in the classroom, basically. So that's where you're learning everything. So very test heavy, textbook heavy, lecture heavy, and then your third and fourth year of medical school is when you do your rotations. Your third year, you're kind of experiencing everything, and then a lot of your fourth year, you've kind of settled or decided maybe one or two specialties that you want to go for, apply for, and then you do what they call audition rotations during your fourth year.
So what ones did you audition for?
So at that point, I knew that I wanted to be an OBGYN. So I specifically did OBGYN rotations, and I focused them all in the St. Louis area because I knew that that was my goal, was to hopefully match for residency in St. Louis.
So where did you do your residency then?
It's through SLU. Mm-hmm. All of their OBGYN stuff is at St. Mary's Hospital in Richmond Heights. So that's where I was at for 4 years during my residency.
That's where one of my first OBs was. Loved that hospital.
I had the best experience there. You get all kinds of wild and crazy stuff. So you learn it all. For sure.
And where do you work now?
I am in Alton, Illinois. So the hospital I'm affiliated with is Alton Memorial Hospital, but BJC did open an outpatient clinic in Edwardsville, which is where I'm from. So I do go there one morning a week just to kind of hit that Edwardsville population, which is nice.
Now, something that's so interesting to me about people who deliver babies is the fact that it's not normal business hours.
It's not.
No.
At all. Oh my gosh. There's no off switch, really.
So what is your call like?
So it's not how it used to be, because no one wanted to go into OBGYN back when you were one doctor that was on call all the time. So they've kind of moved more into a call group type of style, and it's becoming a much more popular specialty now. So I'm in a call group with 6 other physicians. So generally about 1 day a week, you have a call day. So my half day is on Wednesdays. So usually my call day is on Tuesdays, because if I have a terrible night, then I only have a half day of work the next day. And then it's about every 6th or 7th weekend that will be on call. So when you're not on call, you don't have to come in for any of your patients. However, delivering babies is my favorite part of the job. So I kind of have a general guideline that if I'm in town, they call me first so that I can always go in for my own patients. But knowing that I don't have to do that if I'm out of town or at my kid's baseball game or something like that.
And I'm glad you mentioned that too, because I think sometimes we forget that physicians and healthcare workers have actual lives.
Yes.
You are balancing an amazing career, a very demanding career, with 2 sons, who I'm guessing are pretty active.
Yes.
A husband with a career. How is it balancing all of those things?
So initially when I got out of residency, I didn't have as high of a patient load. So I did go in for everything. And then as my patient load started increasing, I was really struggling with that work-life balance. So now I generally make a rule, and this isn't for everyone, but my rule is during the week, I always go in for my own patients. But on the weekends, if I'm not on call, I try to make that my family time.
And that's beautiful.
Yeah.
I have 2 kids. Both of them arrived the day before their due dates, their induction dates.
Yeah.
So not a full surprise, but definitely not the game plan that I had mentally prepared for. With my son, I had no idea what to expect.
Yeah.
And it was still such a whirlwind. With my second, I had my daughter just 16 months later, and she came quickly.
That's how my second was too.
And that's what I've heard. And I've heard
shoot right on out.
And I've heard the 3rd, the 4th, the 5th. It's like your body's like, nope, here you go.
I know. We say never trust a multip.
There you go. But my daughter actually arrived on my OB's birthday.
Oh, yeah.
And my OB, I got to the hospital at 4 o'clock. My daughter arrived at 7:27.
And my gosh, that was fast and furious.
It was. And my OB came in and she's like, Laura, are you serious? It's my birthday. I have a date tonight. And I was like, doctor, it's my second. It's really fine. She's like, are you serious? I'll stay. I'm like, no, go on your date. Can all the other people who are here pull her out?
Yeah.
And she's like, yes, I trust them very much. I'm like, okay, go. And I'm glad I did that. It made a fun story in the follow-up visits, but I truly did have faith in all the other physicians who were there.
Yeah, of course.
Is that something you try to let your patients know too?
Yes. If I always talk to them at their first OB visit, and I say, you know, the labor and delivery nurses, they know that for my patients, they always call me first. But I'm not around and available 24/7. I always try to come in for my own patients. But if I don't, it would be whoever's on call. And I trust all the physicians in my group. Otherwise, I wouldn't be in that group.
And I think that's such an important point to mention. And it's so different when you do get to work in a group. And I think that's such a blessing versus, as you mentioned earlier, there being one doctor and it's all the time.
Yes. Yeah. And there are smaller groups too. So we're lucky that we have a larger group. So there is that opportunity for a lot better work-life balance. And I knew that that's what I wanted going into things, especially with my kids being so young. I really wanted to still be able to be there for their childhood and, you know, go to the baseball games and soccer games. And the labor and delivery nurses are so great. They know I have my littles. I'm the physician in our group with the youngest kids. So I bring them to round with me on the weekends. They love seeing the little babies. And so they're just it's a group effort. Everybody works together. And my husband is very understanding and he's very flexible. He will always get those calls, like a nurse will be calling from my phone and say, can you pick up the kids because Dr. Sauer's in a delivery? So everyone just makes it work.
And that is so amazing because maybe even 20, 30, 40 years ago, society would not have viewed such a strong woman that way.
No, they wouldn't at all. I mean, it used to be mostly men who were obstetricians, and now it is more of a female-dominated field.
And that's, to me, common sense. It should be.
I do nothing against male OBGYNs.
Right.
Like they are great, but I do have a lot there, and even the male OBGYNs will say this. There are a lot of patients who feel more comfortable having a female, and I do think it's beneficial that I've been through a lot of the things they've been through. So I have that experience to say, I know what this feels like. I know what happens when this happens, and so a lot of patients really like that.
Yeah, you have the empathy right there built in. We are talking with Dr. Megan Sauer, an OBGYN with BJC. She works in Alton, not far from Highland and Alhambra, where you grew up. I'm guessing you have started to get patients that you know from childhood.
Yes. Yeah. So now that I've started going to the Edwardsville outpatient clinic, I've had quite a few people who have gone to school with me or my sister. And then actually I am part of a gym in Edwardsville. And a lot of people there don't know that I'm an OBGYN, and you don't know a lot of people's last names. You know their first names. So I've had a few people, women who have come and scheduled an appointment with me, and when I walk in, they're like, I totally didn't realize this was you, because we go to the gym together.
I love that.
So yeah, it's kind of nice.
It is. And they already feel connected to you, and then you're at the gym working out, and they're asking about all of these things that they should be worried about.
I'm an open book.
We're thrilled to have you along here on Live with Laura. We're going to take a quick break. When we come back, we're going to get into more of the things we should be thinking about when we visit our OBs as well. We'll be right back after this. Welcome back to Live with Laura. I'm your host, Laura Hettiger, and it is the end of May, and May is Women's Health Month. So we are focusing on women's health, specifically with Dr. Megan Sauer. She is an OBGYN with BJC. And for this next part of our conversation, Dr. Sauer, I want to talk about the difference of an OB for a woman versus their primary care doctor. Can an OB be both? Is that a good idea?
To a certain extent. So we're trained in management during pregnancy of a lot of primary care things because we treat them differently in pregnancy. So during pregnancy, we'll manage hypertension and diabetes, but outside of pregnancy, that really is more the realm of a primary care provider. So to a certain extent, younger women who don't have any medical problems and maybe are just on a medicine for anxiety and depression, I don't mind prescribing that and managing that. But you eventually get to a realm where it really is more appropriate for a primary care provider to manage things.
So let's talk about when a woman should get an OB.
Yeah, so that is a great question, and I get asked that a lot. I have a lot of patients come in and they're like, I have a daughter who's 14, 15. When should she start coming? So we don't start doing pap smears, which is the cervical cancer screening, until age 21 now. It used to be younger, and so that is a new guideline that not a lot of parents know. So 21, definitely you need to start coming. But prior to then, if teens are having cycle issues, they want to discuss birth control, they need STD screening, really at any time they can start seeing an OBGYN. There are specific pediatric OBGYNs as well. It's a subspecialty called PAGS, Pediatric and Adolescent Gynecology. And so that, because there are some conditions that just affect adolescence. And so really at any time in your life you could.
That is so nice to hear, though, that guidelines are changing because I thought pap smears definitely started at 18. So now 21 if everything is normal. But
Yes.
also that you've added this subspecialty for girls who are dealing with a lot of things.
Yes, yeah. Because some of those conditions they aren't seen as commonly, so that's kind of where they've made this like subspecialty for it.
Mm-hmm.
And so a lot of OBGYNs like myself, I'm not as comfortable treating a 6 or 7-year-old because it's not something that I commonly see. So it's nice knowing that there are subspecialists that I can refer them to.
Especially here in the St. Louis area, it's such a blessing that we do have such a great
kind of everything at our disposal. Yes.
Yeah, we do. Growing up in my small town, we definitely wouldn't have had access to any of that.
Yeah.
I think there was maybe a doctor and one nurse practitioner, and everyone is kind of going to the same person. So it's great that there are different people we can see here if there are issues that come up.
Yeah, for sure.
So when I specifically made the decision with my husband that we were ready to start a family, I had him help me find the OB that would go through this journey with me. What advice do you have for women who have made a decision that they are ready to have kids in finding an OB?
I think it's important to find someone that you feel very comfortable with and not just for having a baby, but it's a very vulnerable situation. So, we deal with areas of the body that it's very vulnerable for someone to see that. And we talk about things that makes patients very nervous to talk about. And so it's a field that it is extremely important for you to feel comfortable and like you are being heard and listened to. And so there's I think word of mouth is great. Mm-hmm. There's a lot of course, Facebook groups and things like that where, there's an Edwardsville Connection page in my town where someone will say, who do you recommend for an OBGYN? So I think just spreading the word if you've had a positive experience is great.
And I'm glad you mentioned the social media aspect of it because there are a lot of problems on social media.
It can be great and terrible.
Yes, but when it is great, it really can be. And you mentioned word of mouth. If you know that your girlfriend was comfortable with this person, then that's going to make you that much more comfortable walking in the door.
And that's how I get a lot of patients. They'll say, oh, I know so-and-so, you delivered her baby, mm-hmm. or I know so-and-so, you did her hysterectomy. So it's word of mouth is great.
Especially during pregnancy, you see your OB a lot.
A lot, yes.
For people who are not familiar, will you please walk through the schedule of appointments that a pregnant woman has?
Yeah, of course. So usually your first visit is around 7 to 8-ish weeks because we want you to be far enough along that we will be able to see a baby inside the uterus. If you get an ultrasound too early, then it can cause a lot of undue anxiety. Mm-hmm. So usually 7 to 8 weeks, and then you will see us every 4 weeks until about 26 to 28 weeks. So the beginning of the third trimester is when you'll switch to every 2 weeks. And then about the last month of pregnancy, you come every week. Now, of course, if patients have different medical problems, they might come more frequently, but that is the general schedule.
So you do see your doctor a lot.
A lot, yes. And then after they have the baby and you go through their postpartum visits, then you go back to the 1 a year woman visit. I tell them I get withdrawals.
Let's talk about that postpartum visit because full disclosure, I talked to Dr. Sauer earlier on some recorded interviews, and you mentioned something about changes and guidelines maybe for postpartum visits.
Yes.
What do those look like today?
So it used to be kind of standard to just come in for a 6-week postpartum visit, and that's all you got. But now they are really pushing for more postpartum visits. And the American College of Obstetrics and Gynecology, they've put out recommendations. So now we are trying, and BJC actually as a whole, I'm on the service line council for them. We are recommending seeing the patient within the first 3 weeks, somewhere in the first 3 weeks, then seeing them at the 12-week mark. And usually you're going to do another one around 6 to 8 weeks in between those. So really extending that time and seeing them more frequently. I
am so glad to hear that.
Yes.
So did this just come out in the last year?
Oh, yes. Yeah. It's been a work in progress, and it's been something that people are really pushing for because there are, postpartum can just be so difficult, and you kind of don't get it until you get it, until you go through it. And it's hard to explain to people who haven't been through it. And so seeing patients more frequently just to check in and see how they're doing. And some patients are doing great and and they feel silly for coming those visits, but I'd say the majority of patients, they're struggling because it's a huge adjustment. And so being there for them and providing any resources they need is very important.
Especially 3 weeks, you're usually still bleeding.
Yes.
6 weeks, maybe you've started sleeping for like chunks of 3 hours. But especially at 12 weeks, that's when most working women
are going back. Yes.
Most lucky working women are going back. So many of them are going back at 2, 4, and 6 weeks.
Yes.
Which I hate.
Yes, I think that's another thing that there is a lot of push for now, is longer maternity leaves and just better postpartum care in general.
Let's talk about maternal mental health.
Yes, yeah.
Maybe it's because of the age I am, but I feel like we do a better job about talking about postpartum depression. But I've still learned so much since having my kids that there are so many other things. Postpartum anxiety, which I definitely had. Postpartum OCD that I've read about.
Yeah.
But as a new mom, you're so scared to even tell anyone that because your biggest fear is, oh my gosh, what if I say something and then my kids are taken away?
Yes, and they think I'm crazy and losing my mind. So I think it's really important to normalize maternal mental health struggles, not just postpartum, but during pregnancy as well. I think people talk a lot about postpartum depression, but it can start in your pregnancy, and it often does. So I think the biggest thing is start normalizing that. It doesn't mean you're crazy. It doesn't mean there's something wrong with you. Normalize this so that patients feel comfortable having these discussions with you, and they don't feel shame or fear of judgment.
Something that I learned from a guest who was sitting in that seat just 2 months ago, a very powerful female attorney with 2 kids. And my gosh, this woman could take on the world. And I always thought postpartum depression started pretty quickly after you had a baby. And she said for her, it set in at about 6 to 8 months after
later. Yes.
I had no idea.
Yeah, so really it could hit months down the road. Because sometimes after you have a baby, you're almost in like fight or flight mode a little bit. Like you're in survival mode. You are just trying to get through each day. And then, you're running on like all this like adrenaline sometimes, and it can hit months down the road. It's the same if you have, a traumatic life experience. You may not get all of that anxiety, depression stuff right after. It may hit months down the road, a year down the road. So yes, it's not just right after delivery. It can hit further on down.
So how can we be better about explaining that to women?
I think it's important to talk about mental health throughout the pregnancy and postpartum period. So another thing that the American College of Obstetrics and Gynecology, or ACOG is what we call it to shorten it, is they're recommending more frequent assessment of maternal mental health throughout the pregnancy, and then just make sure at their postpartum visits that you're checking in on mood and saying, even if you're doing well now, it could, something could hit later on, and I want you to come and see me and talk to me.
That would be best case scenario. At the same time, you're thinking, okay, I'm here at this postpartum visit. I have like 20 minutes. The baby's right there already crying, or I have to get back to work. I've already taken all these weeks off for maternity leave. So maybe women are not as open and forthcoming as they should be.
Yes.
So let's focus on partners and good friends and even parents who are close to a newer mom.
Yes, check on them.
What are things they should be asking or looking for?
So I think that not just checking in on them, but offering to give them breaks to help them out, because as you know, moms, we just say, no, we're fine. We're fine. I don't need help. I can do it. Just do it. Just offer. Just, my mom and mother-in-law would just show up and say, I'm going to do your laundry today, or I'm going to clean your house, or something. So little things like that. I know that's not a mental health coping technique by any means, but sometimes just getting the workload off of them can be helpful. Or say you're going to hold the baby while they take a shower or a nap or something, just something to like rejuvenate themselves. But it is very important for the partner to be cognizant of how their wife or girlfriend, or how they are acting, and, look out for any signs that they may really be struggling mentally.
And what about friends?
Oh, friends, of course, too. Sometimes, because sometimes both partners are struggling. And so they're both so in the thick of it that they're not realizing how each other is doing. So friends are important too, to check on, just like how you would want to be treated if you had just had a baby.
Let's talk about after most women have their babies, and thank goodness we're living in a world where women into their late 30s and 40s can have kids. That's awesome to me. But something I've been reading a lot about is perimenopause.
It's a hot topic.
Yeah. What is it?
Yeah. So perimenopause is basically the time, or like premenopause, you can think of it. However, it doesn't follow like any rules. There's really not clear guidelines for it. So that's what makes it such a big mystery. So the average age of menopause is 51. Obviously, women go through menopause before then, women go through it after then. And we say that you are in menopause when you go a full year without a cycle, or if you've had a hysterectomy, your hormone levels could reflect that. But this perimenopausal time period can last for years, even as long as 10 to 12 years beforehand. So women can be in their early 40s or even like late 30s sometimes and start experiencing menopausal symptoms and think that they're crazy because they're too young, but it's really that perimenopausal time period starting for them.
What are these symptoms?
So they could start having hot flashes, night sweats. Those are the typical ones you hear. But perimenopause and menopause can cause so much more than that. You can get mood changes, brain fog, their skin changes, joint pain, hair changes. I mean, it can cause so much.
So what's so interesting, every single symptom you just went through, I'm like, I have had this like in the last week. But I haven't thought I'm perimenopausal. I've just thought, my gosh, it was really hot in my bedroom, or my gosh, it's really hot at work. When should it start clicking that, no, these are probably perimenopause?
Yeah, so it's hard because there's a lot of talk about getting your hormone levels checked.
Mm-hmm.
And so that's like a big thing on social media right now, but it's actually not very accurate in the perimenopausal time period because you get these erratic fluctuations. So you could get your blood drawn at 8 in the morning and then get it drawn at 3 p.m. and you'll have completely different lab results. And so it's really hard to capture these erratic fluctuations. So it's kind of like a diagnosis of exclusion almost, or you just kind of a trial and error things because there's no like one test that can say you're for certain in perimenopause. So I usually tell patients to start with like lifestyle modification stuff, sleep in like less clothing, have a fan on, get a cooling blanket. And if you're doing that and you are still getting these crazy night sweats and hot flashes and stuff, then it may be a perimenopause thing.
But is there anything that can be done?
Yes, of course.
There is?
Yes.
Okay.
We have tons of treatment options.
I need the details. I'm going to be
Yeah.
texting all my girlfriends.
Yeah. So, I mean, of course, people talk about hormone replacement therapy, and it does get a little bit of a bad rap sometimes because there are risks associated with hormone replacement therapy. But there's also non-hormonal options, and there's some supplemental options too that patients will try. There's also some evidence for like cognitive behavioral therapy to help with things. So they're coming out with more and more and they've even looked into hypnosis and things. I went to this menopause conference in October and they were talking about these newer things. So there's a lot in the works with menopause, which is great because it's an area of gynecologic health that is not really well taught and hasn't been well studied. And so it's great that we're getting more resources and more data.
Especially because I'm thinking, I know your mom's going to be watching this episode.
Yes.
My mom will be too. I'm going to venture to guess they're around the same age. And definitely when they were our ages, they weren't talking about perimenopause.
No.
And when they went into menopause, they didn't talk about it either. It was just, this is happening and I have to be quiet about it.
Yes. And there's so much, honestly, about like female health, women's health that isn't talked about. And so, I have patients who come to me with certain concerns and I'm like, this is so common. And they're like, I had no idea this was so common. I thought there was something wrong with me. And I'm like, it's just not, no one wants to talk about your vagina or anything, but it's, maternal health and female health is very important.
And I'm so glad that we are having this conversation in this way because maybe it will make another woman who's listening right now feel a bit more comfortable. And when she goes and visits her OB or primary care doctor again, that she feels more empowered to bring it up.
Yes, of course.
I love these conversations on Live with Laura, and stick around because we are not done. We're going to take a quick 2-minute break. In that time, I hope you share this with your best girlfriend or your sister or your cousin, whoever it may be, who you guys have been secretly talking about. Do you think it's perimenopause? Am I going into menopause? Is this happening to you too? We all do it. Share, because Dr. Sauer is being so kind to give us so much of her time and her expertise on this very important topic of women's health. We'll be right back with more of Live with Laura. Welcome back to Live with Laura. We have just a few more moments together on this episode where we are focusing all things women's health. I am sitting across from Dr. Megan Sauer. She is a Southern Illinois gal who now works at Alton Memorial Hospital with BJC as an OBGYN. And Dr. Sauer, I want to go back a little bit earlier in life for girls. What can we as moms do and parents do to normalize talking about things that happen in girls' bodies?
Yes. So I think it's very important to not just let the health class in high school think that that's all that they need. It's really important for you to have those conversations with your daughters. And I have 2 sons, so, this is something that I will not have to go through with them. I mean, they have their own kind of things to talk about. But one thing that my MA has done for her daughter is she has made a little pouch to keep in her bag for if she does start her cycle. So she's prepped her for that, just to know what to expect. And she has that so that she's ready if that time comes. I think that's a great thing. And it's starting, menstrual cycles are starting earlier and earlier now. So you really want to start having those conversations earlier so that your daughter does know what to expect when that time comes.
Having 2 boys, will you talk to them, though, about a woman's cycle in case a girl does start it in their class and maybe kids can see it on her clothes?
I will. I know that that's probably not the norm, but I'm also a little bit of an open book with my boys. Like, they do know what mommy does for a living. They know how babies are born. And, some people may say that's wrong because they're 3 and 7, but I do have those conversations because I think it's important. You don't want to make fun of them. And so it's important for them to know what's going on too.
Working with women, what do you wish women gave themselves more grace about?
Oh my gosh. It's a loaded question, tough question. I just think that grace about managing everything. I mean, I know that not every woman works outside of the house, and not every woman has another partner. So every female's in different situations, but just give yourself grace for all that you're going through. Because honestly, the hormone fluctuations you go through monthly, that's a lot to manage on its own. And then you throw kids and a job and dinner and cleaning, and just we have so much on our plate, and it's very important to give ourselves grace and not try to be social media perfect, because that's a big thing these days. Instagram versus reality. It's just no one's picture perfect, and you just got to give yourself grace. And I've had someone make this analogy that it was something about glass balls. Like, if different areas of your life are glass balls and different areas are paper balls. And so, like, your family, your kids, those are those glass balls, and you don't want to, those are the ones that can break. And when they break, it's really hard to put those back together. So don't focus on these paper balls, like the picture perfect house and the decluttering and organizing. Like, pay attention to those glass balls that can't be put back together as easily.
Great advice. I love that analogy. You care for women during some of the best times of their lives, yet also maybe the hardest for women who are dealing with infertility, I would think. How has that changed you as a person?
Yeah, so I always say that this field has the highest of highs and the lowest of lows. And so it isn't all rainbows and butterflies. There is a lot of difficult things that we deal with. Infertility is a huge one. The emotional stress that causes on a female is unbelievable. And also loss. We deal with fetal loss, child loss. And so I think it's really important to support patients and let them know that they are not alone, because they probably feel alone and they don't want to talk to other people. No one wants to talk about infertility to other people because you hide that you're trying, or you hide that you have had an early loss a lot of times. And so I think being someone that they can just talk to is really important. And I've gone through infertility struggles myself. And so I can sit there and I can cry with them and I can tell them that I know how horrible this feels. And so I think just like being a person and not necessarily a provider, although you are, but just like talking to them like a person is really helpful.
And I'm very sorry about the infertility struggles that you've dealt with too.
Thank you.
When someone does share, the person on the receiving end of that news, I think with all bad news, we want to instantly say, well, it'll be okay. It'll be okay. What advice do you have for family members or friends who does have someone close to them who is struggling with infertility or an early fetal loss on things we should, or maybe most importantly, should not say?
Yeah, so I know I get what you're saying, or I see what you're saying with you always want to say, it's okay, it'll come. But sometimes it doesn't.
Mm-hmm.
You know, unfortunately, sometimes the infertility doesn't end up in them getting pregnant. And so sometimes maybe not necessarily saying it that way, but just saying more, I'm here for you. What do you need? Do you need to talk? Do you need a shoulder to cry on? Do you need me to, you know, take you to get your nails done or something and just have like a girl's day? And so like I had a friend who was going through infertility and I sent her an Etsy bracelet, like a fertility Etsy bracelet. So just little kind gestures that let you know that you're thinking about them, I think is really important, and just checking on them frequently and just letting them know that you're there for them.
If you could go back and talk to yourself that third year of medical school and give her one piece of advice for following into the OBGYN specialty, what would you tell her back then?
So I always joke that because it can be a grueling day-to-day job, and I always joke that some days I intermittently don't like my job and I intermittently love my job. But honestly, when I think about it, if I went back, I could never choose a different specialty. I just couldn't. I know that there's way easier, or I shouldn't say easier, but way easier on your lifestyle specialties and maybe on your stress level and your anxiety level. But at the end of the day, like I couldn't do anything else. And so I would tell her, just go for it. Because there were so many times during my training, residency, and even like med school when I was applying for residency that I was like, I'm never going to get there. How am I going to make it through? And so I would just say, keep going. You're going to do it. Keep going, and it's going to be worth it.
Because it is such a grueling process that I think regular people outside of healthcare don't see and totally forget about.
Yeah.
We don't realize how many years, how many sleepless nights.
Yeah.
Yes, because as we mentioned earlier, babies don't come 9 to 5 Monday through Friday.
They don't. And so it's funny because in residency, I mean, we never got sleep in residency. We would work 30 plus hour shifts. I mean, it was crazy. And now I like complain, you know, if I get woken up one time in the night. So yes, it's grueling, but you know, I'll say it again. There's something so special about being part of the best day of someone else's life.
And for any moms who are listening or watching right now, they're instantly going back to the day that their baby was born.
Yes.
And put on your chest, best feeling in the world.
It truly is.
People have fallen in love with you in this conversation. I already know that. Are you accepting new patients?
I am, yes. So both at my Alton location and at the Edwardsville location, accepting new patients at both of them.
And how can they get in contact with you?
They can call the office number and they will just put them on as early as possible.
Dr. Megan Sauer with BJC and OBGYN, a local girl turned awesome doctor from the Illinois side. What a treat. Thank you so much for spending part of your day here with us.
Thank you for having me.
And friends at home, until next time, thank you for listening, thank you for learning, and thank you for being live with Laura.